Aims of first aid: to preserve life, to prevent the worsening of one's medical condition, to promote recovery, to help ensure safe transportation to the nearest healthcare facility. Steps in dealing with an emergency situation. Step 1. Make the area safe. Step 2. Evaluate the condition of the sick or injured person. Step 3. Seek help. Step 4. Provide first aid. Procedures in performing CPR, including chest compressions between adult and infant. First, if the person is unconscious and is not on his back, turn him on his back. 2. Kneel beside the casualty. 3. Left the chain forwards with the index and middle finger of hand while pressing the forehead backwards with the palm of the other hand. Number 4. Observe breathing by listening, feeling, and looking. 5. After opening the victim's airway, check to see if the victim is breathing.
Okay.
If the casualty's chest still fails to rise, first assume that the airway is not fully open. Once the airway is cleared, the casualty may begin breathing.
Oh.
How to give chest compressions between adult and infant. Number 1, turn the casualty on his back on a hard surface. If not already, kneel next for the casualty beside his upper arm. Number 3, place the heel of one hand in the center of the person's chest. Number 4, place the heel of the other hand on top of your first hand.
Yo.
Number 5, lock your fingers of both hands together. Number 6, make sure your shoulders are directly above the person's chest. Number 7, with outstretched arms, push 5 to maximum 6 centimeters downward. Number 8, release the pressure and avoid leaning on the chest between compressions to allow full chest recoil. Number 9, do not allow your hands to shift or come away from the breast cone. Resuscitation of baby or child less than 1 year old who is not breathing or not breathing normally. Safety first and call for help. Number 1, make sure there is no danger to you before giving help. Number 2, the child need urgent help. Shout or call for help if you are alone, but do not leave the person unattended. Number 3, lay the baby or child down on the floor or hard and safe surface. 4, move the baby's or child head backwards and lift its chin slightly. And the last one, check for breathing.
Yo.
How to give chest compressions on a baby or child less than 1 year old. Number 1, place put 3 fingers of your hand on the center of the baby's or child on its breastbone. Number 2, remove the bottom fingers of the 3 fingers and compress the chest with the 2 remaining fingers, middle and index finger, up to 1/3 of the dip from the chest of the baby or child. Number 3, repeat these compressions 30 times at a rate of 100 to 120 per minute.
Oh.
Drowning causes asphyxia by water, weeds, and muds entering into the lungs. A victim is in the water and is in distress. These are the following signs of drowning: no breathing, difficulty in breathing, the breaths get shorter. Make sure there is no danger to you of drowning. If the person is drowning, the person urgently need help. Remove the person rapidly and safely from the water, but do not place yourself into any danger by doing so. Then try to throw a rope or something that the drowning person can hold on to. Once the person has been rescued from the water, do not try to remove water from the lungs.
Go.
If the person is breathing, put him in the recovery position and cover him in a blanket or coat to keep him warm. Do not leave the person alone, and you need to continue to observe him. If the victim is not breathing or not breathing carefully, remove any cause of suffocation. If the person is not on his back, turn him on his back. Kneel down by the side of the person. Choking. When a person is having severe difficulty in breathing because of an obstructed airway or lack of air, he is choking. When a person is choking, you may observe the following. The person has difficulty in breathing. He tries to cough something out, but it does not help. He cannot speak or make any sound. What do I do in case a person is choking? Approach and help the choking persons. Ask the person, "Are you choking?" What do I do if the person cannot speak, cough, or breathe? Number 1, stand to the side and a little behind the choking person. Support the person's chest with one hand and bend him forward. Give 5 firm blows between the person's shoulder blades. What do I do if the object did not come out and the person is still choking? Stand behind the choking person and put both hands around him. Make a first and places it between the navel and lower tip of the breastbone of the person. Bend the choking person forward and pull your first firmly towards you and give 5 abdominal thrust. Strangulation and hanging. The airway is squeezed, its pressure is exerted on the outside of the neck, and by such an act, the flow of air into the lungs is cut off. Safety first and call for help. Number 1, make sure there's no danger to you. Number 2, the person needs urgently help. Number 3, cut or remove the band con- contracting the throat. Number 4, lay the person on the ground. Number 5, be careful while moving the victim as he may suffer neck injuries.